In this important lecture today, I will be talking about the logbook that is required to be submitted by every candidate giving the fellowship exam of the college, whether it is the FCCCM exam or the Advanced Fellowship in Intensive Care, which is the AFIC exam. Many things have changed in the logbook requirements this year onwards, so please pay attention. The logbook carries 10% weightage out of the whole examination process. These 10 out of 100 marks are very important in each candidate's career, because a person who is just borderline fail, these 10 marks added on to the overall exam can make him pass the exam. Or if you're a good candidate, then it may give you an edge over your other competitors so that you can rank first or second in the exam. While the theory component, the OSCE component, the communication component, and the e-cases component, they represent your performance at one point in time, whereas the logbook evaluates your performance throughout the year, and therefore it is a very important reflection of how you're doing. We all know that sometimes on the day of the exam something happens, you have a bad migraine, you got some bad news when you were leaving the home, it can affect your performance, and therefore the logbook is a very important reflection of your capabilities. So now let's look at how to prepare the logbook. Let's understand what are the various components of the logbook, how you should go about preparing each component, how you should store it, and then how you should send it to the college. In the past, logbooks had to be printed, spirally bound, and couriered to the office. Now this is no longer required, and you send the digital format of your logbook on a pen drive, in fact on 2 pen drives, and also transfer your logbook using transfer websites like vtransfer.com. We will talk more in detail about this. Let us now understand the components of a logbook. There are two basic components. One is the clinical cases. Templates are available to help you write down the clinical cases in the desired format, but overall you need to know that you need to submit 5 cases. But it's very important not to have all the 5 cases pertaining to the same system. So have a neuro case, have a cardiac case, have an abdominal case, have sepsis, have a metabolic disorder. So be varied in your selection of cases. The second is investigative critical care, which is a big group and essentially has those components which you face in the OSCEs. So you will have ABGs, biochemistries, and biochemistry includes blood and other fluids like urine, pleural fluid, ascitic fluid, CSF. You have ECGs, hematology coagulation, imaging like X-rays, CTs and MRIs, and then drugs, equipment and grafts. This picture also shows you how many you need to submit to complete that category. So you need to submit 10 ABGs fully worked up, 10 biochemistries including blood and other fluids, 5 ECGs, 5 hematology coagulation studies, 5 X-ray studies, 5 CT or MRI, 5 drugs, 5 equipments and 5 grafts. We will spend more time and go into details of each of these. In order to maintain uniformity in the logbook, templates are available on the college website, icueducation.com or the collegeofcriticalcare.com. If you go to the download section of icueducation.com, you will see these templates serially listed one below the other. You have the ABG template for logbook, which will be in a document format, MS Office document format, so that you can immediately start writing in that. You will also have a file which is a supporting file called instructions for filling up this template. And then you will have a sample template filled properly so that you can see what a completed ABG template would look like. Same way you have these three for biochemistries, ECGs, and all the other categories. You also may have a zipped version, and if you have a zipped version and you download it, all the relevant files of that category will be downloaded. And how do you download is you click on the downward arrow and it will be downloaded to your computer. Let's start with an ABG template. When you download the ABG template, you will see various things. On the top left hand, you see the section is ABG, and on the right hand, you see ABG number. Obviously, since you have to submit 10 blood gases, you will number them sequentially as ABG number 1, ABG number 2, ABG number 3, etc. In the history column, you need to write a short, crisp history that is relevant to the blood gas. 3 or 4 lines at the most. Then you come to the important data group. In data, for blood gases, the parameters are already filled up. So you know that you have to write the FiO2, the pH, PaO2, PCO2, bicarbonate, and the electrolytes. And the normal range is also given here. You can change it. Instead of millimoles per liter, you can write milliequivalents per liter. That's fine. That's appropriate to do that. But you must enter the observed value from an actual blood gas that you've seen. Don't copy it from the internet. It will be picked up. Let them be original cases there. What is the purpose of this second table that is there, where you've got now certain parameters are relevant to a blood gas interpretation but not available in this table, like urine electrolytes if you have a normal and iron gap metabolic acidosis, and sometimes in metabolic alkalosis you may want to know urinary chloride for volume assessment. So those parameters you can put in the second table with the observed value and the normal range if it is there. Urinary electrolytes very often don't have a normal range. You have to interpret it based on the scenario. Having entered the data, then you answer and solve this ABG in terms of what is the oxygenation status, what is the ventilatory status, what is the acid-base status, and finally, very, very important, write a conclusion and discussion correlating the blood gas analysis with the history and scenario. Again, to maintain uniformity, always use the same font. Times Roman and Arial are two popular fonts. Size 10 is a good size for your logbook, so maintain the same throughout your logbook. Here you can see a template on the left hand side and a filled template on the right hand side, and you can see the ABG has been numbered, a short history is given, the observed values have been entered, the oxygenation status, ventilatory and acid base status have been properly filled in the appropriate columns. On this slide, you see a completed template, ABG template, but you also see very prominently the actual ABG which has been scanned and saved as a PDF file. You must never forget to enter the normal values and the observed value, except where it is not required, like as I told you, urinary electrolytes, you don't have to do that. The template has to be saved as a docx or a doc file, which is the docx is the newer version of Word document. So you'll save it as your name, not the patient's name, your name, underscore, what is the component, here it's ABG, underscore 1 or underscore 2, underscore 3, as you do different ABGs. The supporting file has a similar structure, but it ends in PDF, and that allows us to know whether we're looking at the completed template or we're looking at a supporting file. Your pen drive will then have in the ABG section ABG1 in the actual template supporting, ABG2 actual supporting, ABG3 actual supporting, etc. Saving the completed ABG on a pen drive. First of all, your whole logbook will come on a single pen drive. Use a new pen drive and don't use the USB one as far as possible, because that's a model that's going out, and most of the modern laptops don't even have a USB port. They have a C-type port like you have on your mobiles. So buy a dual USB with a USB and a C-type, and I will show you these. Use a new one. Create a main folder. So create a folder and call it your logbook. So it will be logbook of Praveen Kumar Jain. Which is the exam you're giving? FCCCM 2024 or AFIC 24. This is not the year you registered. It should be the year you're giving the exam. So then it could be 2025. Create 9 folders under this, and they will be which are given there: ECGs, ABGs, biochemistry, X-rays, CTs, hematology, equipment. Now under ABG, create 5 or 10 or whatever number is required for that section, those folders. So in ABG you need to have 10 ABGs. So I will make 10 folders and call them ABG1, ABG2, ABG3, all the way up to ABG10. Then under each ABG subheading, like ABG1, I will put in 2 files. One is the completed template, which will be in docx format, and the supporting, which will be in a PDF format. And once I've done this, I will collapse ABG1 and go on to completing ABG2, etc. And you will do the same thing for all the various components in your logbook. Choosing the right type of pen drive is very important. While this black and red type of pen drives are very popular from SanDisk, they are slowly being faded out. So try to avoid this. Never ever use this card type ones where the element opens up here. They are just no. And never submit the logbook on a CD. What you should do is use a dual USB and C type pen drive. Now what is a dual USB and C type pen drive? On one side you have a USB, on the other side you have a C type port. So it can fit in with either of them. And don't forget to label the pen drive with your name, your exam, and the year you're appearing. Having done that and put your logbook, before you send it to the office, remember to protect the pen drive, and you will send it in duplicate form. So make 2 copies of it, label both of them, and send it in a protective hard box, which may be of plastic or hardboard or wood or whatever. And these are easily available online on Amazon, and you will find them. One of the problems that occurs is, and I've seen this almost every year, some candidates do that, while copying the files from the computer to the pen drive, instead of copying the file, they copy the link. And when they test the pen drive and they click on the link without knowing that it's a link, obviously it's linked to the original file and the file opens. So you think everything is okay. But when it comes to the office and we look at it, we click on the link, but there is no supporting original file where the computer will take us. And that's a big waste of effort. So make it a point to take this pen drive and plug it into another computer or laptop and click on each and every one of the files to see that the original is on the pen drive itself and it is not just a link. Then while couriering it to the office, put it in a protective box And just like you label the pen drive, also label the box inside, outside, both. You could put it here, you could put it on the cover here, your name, your exam, put your mobile number, you could put your city, whatever, so that it's not confused with anyone else. So this is where you physically send in or submit the logbook, but to still be on the safe side, it is wise to transfer it online using free transfer sites like vtransfer.com. The whole logbook is compressed into a single zipped file, and files up to 2 terabyte, I believe, or 1 terabyte definitely, can be sent. All you need to do is attach that file on the website, write your email, and write the email where you want to send it to, which will be the college email. Because choosing the right type of pen drive is very important, I'm actually showing you a few varieties of the dual USB Type-C pen drives. This is one in which on one side you can slide it and the C type will come out, and if you slide to the other side, your USB type interface will come out. The other is like this, where there is no slider, but you have on one side a C type and on the other side a USB. Or even this is very popular, where on one side there is a type C, on the other there is a USB type interface, and so make it a point to buy one of this for your logbook. The parameter that you type should be in the proper column. Its observed value and normal range, I've already stressed, must be entered, and that is important. But it's also equally important when you're putting in biochemistry to put in all similar types of parameters together. So the serum would be together, urine parameters would be together, plural ones should be together, and it makes it more presentable and easy to interpret. In the past, X-ray films had to be actually sent to the college, but we have done away with that. We don't need the films, let them be with the patient. But what you need to do is get an image of the X-ray, a good quality image, either as JPEG or a DICOM format, which if you have good relationships with your radiology and the hospital permits, they will copy it on a pen drive and give to you, or copy it on a CD and give to you. If you don't have access to the radiology department giving you the file, then you could put the X-ray on a view box and take efforts to learn how to photograph an X-ray or a CT properly by not using the flash, by positioning your camera properly so that there is no distortion, and we will look at some of the distortions that can occur, and then save this image immediately as X-ray or CT _1 _ as we said, with your name also there. If it's a JPEG, which is fine, it's JPG or JPEG, and a DICOM, which you can only get from the department, will be .dcm. All the templates are very similar in structure. The X-ray and CT components also are similar. You have the section name, in this case X-rays, X-ray number, small history, and this is the area where it says X-ray image, where you will import the image into this area. Name of the X-ray that you've given, whatever you used, you need to enter it here, and your observations and interpretation will come here. I forgot to mention earlier that in the header part of every template, you will have an option to put your name, institute, and which examination you're appearing for, and the year where you will be giving the exam. This is how a completed X-ray or CT template will look like. Short history, the X-ray number is given, the image very clear and crisp is there, distortion free, the name of the file, which is the name of the candidate _ X-ray _ the X-ray number, etc., and the interpretation is there. Like all other OS keys or components that you have, whether it's blood gases or cases or any other component, CT scan, remember to select from different categories. So don't just put all 5 or all 10 as X-rays of the chest. Have a head X-ray, have a neck X-ray, have a chest, have one of the abdomen. You can repeat one of them. So have a good spectrum of case that you submit. Here you can see that a well exposed X-ray is so easier to understand, but an overexposed or underexposed X-ray becomes very difficult to interpret. So be very careful in what you're submitting. Again, examples of photographs of X-rays which are substandard, unacceptable, they are distorted, they show that you have not bothered to take efforts, and it reflects very badly on you, and most of the time they get rejected. And don't hold the X-ray in one hand against the wall or window. Please, you work in a hospital, put it on a view box and take a good quality photograph of the X-ray or CT or MRI that you have. To avoid distortion, it's very important that you're parallel to the X-ray, and your viewfinder on your mobile or wherever you're taking it with the camera should match the top of the X-ray, the bottom of the X-ray, the right and left side. Otherwise, you will get distortions of trapezoid X-rays instead of a rectangular X-ray. So for a good X-ray, the top of the X-ray, the bottom of the X-ray should match the image that you're seeing on your mobile. At the top of your mobile, the bottom edge of your mobile should be parallel. And this will happen if you are using a camera that is equidistant from the top and the bottom, and certainly do not use a flash because that gives a big distortion in the center. This is what happens when your camera is not equidistant from the top and bottom and is not facing the X-ray or CT film. You will get trapezoid looking X-rays and rotated X-rays, etc., instead of a well centered X-ray where the edges are parallel with your mobile or your camera. ECGs should not be put on the table and photographed with your mobile. They tend to get distortions, and I will show you. Use a flatbed scanner. If you don't have a flatbed scanner, see if your IT department has, and they'll oblige you. Or you can go to any stationery bookshop and ask their printing facilities. If they're there, they usually will have a scanner facility, and they may charge you a few rupees to do that. But you get very good quality images. All ECGs submitted must be scanned images. This is how a scanned image should be: very clear, crisp, and uniformly lit, not one side dark, one side light. These are examples of unacceptable images being sent. They shouldn't be very crumbled like this. They shouldn't be dark spots and light spots, etc. Only one way to submit ECGs: flatbed scanner. How many marks would you give to this type of an ECG? And on the background, I've shown you ECG that is on a flatbed scanner, and this is what a candidate, in spite of telling, took on his mobile very casually in a dark lit area. So you now have the ECG template, very similar in structure, and the ECG image is put in similar to what the X-ray image was, and you put it here. See how uniformly lit it is and well readable. That's the way it should be. When submitting CT scans or MRIs, each film has multiple images and it becomes very confusing, especially if you try to compress the whole image or the whole film onto a page, an A4 page. What you should submit is not the whole film, but just one or two pictures which are of relevance. So this is how you would submit it: a CT of the head, CT of the chest, showing an aortic dissection, showing an embolism, etc. On the left hand side, you see someone who submitted the whole film. Each one becomes very small. What you should do is just select one or two areas of interest, and like you see on the right hand side, just put that image. These are examples of unacceptable CT scans or MRIs. They're distorted, they're not properly uniformly lit, they show a very casual attitude of the candidate, and that impression is not a good impression to have with your examiners. Also, unacceptable images there, though the last one is very clear, very crisp. You don't need so many images unless you're bringing out some point. You could just have selected an area of interest. Other categories are all very similar: hematology and coagulation. Don't include all hematology or all coagulation. See to it that there is some hematology selected, some coagulation study suggested, and the structure is very similar. Some words of advice. Do not delay your logbook till the last minute. It's always good to finish it as soon as possible, otherwise you're in a big quandary. The exams are few months away, 2 months away, 1 month away. You're desperate to do your logbook. You start doing your logbook, you feel guilty you're not studying. If you study, you feel guilty that you're not doing your logbook, and life becomes miserable. Trust me, majority of you would then just not appear for the exam and say you're not prepared, it's too much, and you'll appear next year. Don't do that. Finish your logbook as soon as possible, and so you are totally focused on reading and preparing for your exams. The logbooks must reach the college at least 2 months before your expected exam date. The full logbook must be sent in the pen drive as a single file and in duplicate. We have seen that when we receive duplicates, one of the pen drive, there's a read error or some files will not open, but that will not happen if a backup is available, and so the processing of evaluation can be done easily. Do not use a CD or DVD. And remember, put in your best. You should be very proud. Your logbook is like your thesis, and even later on in life when you're going to become a consultant, especially if you're doing so abroad, presenting your logbook to the examiners or to your interviewers creates a very good impression of work that you have done. It reflects you, and therefore it must be as good as you are. Be positive in your outlook. Don't think of yourself as a pawn. You are the future of critical care. You are the future professor of critical care. You are the future intensivist whom families and relatives will depend on. You are going to lead critical care. So remember, even Einstein was at one time a student. You have to grow, and grow with a very positive feeling about yourself. All of you should submit a logbook. All right? All of you should try to submit a logbook. But sometimes, especially if you're working abroad, it becomes very difficult to get data pertaining to patients, and therefore the alternative you can use at that time is what is called the academic diary. If you have registered for the exam and you find that you will not be able to collect the data required for the logbook, very early you must approach the college and present your case so that you may be afforded the opportunity to gain points, those vital 10 points, in the form of an academic diary. Alright, academic diary is an Excel sheet where you put in all the data and you get your marks. If you look at bottom of this slide, you will see the cover, the summary, others, CCF lectures, worksheets, PowerPoints, conferences, etc. When you enter data into these respective sheets, the total marks get added here. You need to accumulate 150 marks to get the full 10 out of 10 marks that the academic diary has. The pages of the academic diary are self-explanatory. You cannot enter anything on the cover page, and only the white areas are where you can write something. So you start using it. Always important when you receive an academic diary to rename it as your name, academic diary, this exam, and have a backup so that if you mess up the academic diary and you delete something by mistake, you have another academic diary which you can fill. The academic diary should not be your first choice over a logbook there. Okay, this is only a second best option to use the academic diary so that you don't miss out on those 10 points. As you go to various sections, and this is in others, it says did you attend the orientation course? When you click on the side, there's a drop down menu. If you say yes, then automatically 30 points are displayed. If you attended the crash course, you say yes, another 30 points are displayed here. Most of the places you will need to submit proof of orientation class, proof of attending a national conference or international conference, proof of presenting a PowerPoint, etc. So this on the summary page is a checkpoint. So it says here it reflects what you have entered inside, so that place where you filled up that you attended the orientation, the 30 points come here, and it shows you the remaining how many more you need to accumulate. All right, proof submitted, it's just a reminder that you need to submit it along instead of the logbook on a pen drive and using WeTransfer to the college. What are the options to collect 150 points? Well, the orientation is worth 30 ACP points. The crash course is 30. It's almost mandatory to do both of them. So that's 60 straight away. You now have 90 left. You can make PowerPoint presentation with voiceover, and you get about, if it's well done, you can get up to 7 marks per presentation, or if it's okay, then you will get about 4 marks. You can subscribe to and listen to online courses that you have at icueducation.com, and each one of them has different ACP values. They may be 5, 7, 10, 15, whatever. It's displayed there, so you can choose that. This is the easiest because you just have to listen to it. There's no test or anything. You submit proof of subscribing to that course and you get the points. You can attempt and pass various self-assessment online, but remember, only if you pass the self-assessment will you actually get points. And though some points are given for attempting it, but keep this as secondary to doing the online courses. You can attend regional conferences. One day conference I think has 10 points, 2 day has 20 points, 3 days or beyond has 30 points. You can get an appraisal by the head of department, and I think you get 5 points for that. ACLS certificate or ventilator workshop certificate each carry about 5 marks. So there are various ways in which you can accumulate that 150 points. When it comes to presentation, when you click on it, you get the option whether you just attended it, submitted it, was it a good presentation, did you present it, or it was plagiarism, and therefore the college may not give you marks or give you negative marks. So like plagiarism was detected -3, it was presented 7 points, it was just submitted 2 points, attended 2 points, and the summary will keep a track of everything that you did. So you attended orientation, you got 30 points, you submitted some PowerPoint presentations and you got 12, total becomes 42, and the balance will always be shown in the Excel sheet. The aim is to collect 150 points. Every year we get very enthusiastic candidates, and they don't restrict to 150. I've seen someone go up to almost 280, 290, 300, 320 ACP points. The moment it goes above 150, you start getting a negative. That means you have exceeded by 4, which is good. There's no penalty for that. The FCCCM exam and the AFIC exam is without doubt a life-changing exam. You will never be the same. Your colleagues, your friends, your students will appreciate the change that you've undergone in this 1 or 2 years. So be very careful, meticulous about everything that you do, including your logbook.